Hi class! In this first part of the lecture, we will be going through the diseases of the digestive system, which is also known as the gastrointestinal system. Let's take a look at the diseases we'll be covering today. Starting with the mouth, we'll be looking at aphthous ulcers. Then moving down to the esophagus, we'll be looking at GERD, which stands for gastroesophageal reflux disease. Next, we'll look at gastritis and peptic ulcers, which affect the stomach. In part 2 of the lecture, we'll move down to the colon and look at different types of diarrhea. In part 3, we'll be covering liver diseases such as viral hepatitis and liver cirrhosis. First, let's look at the mouth. Any inflammation affecting the mucous membranes of the mouth and lips is referred to as stomatitis. A common type of stomatitis is aphthous ulcers, which can occur along the inside of the lips or cheeks or underneath the tongue. Here in these pictures, you can see a small aphthous ulcer on the left and a large one on the right. It's not exactly clear what causes aphthous ulcers, but some factors can increase the risk of getting these ulcers. For example, stress, trauma to the area, which could be physical, like accidentally biting the lip, or exposure to an irritant chemical, food allergies, or infections. Since aphthous ulcers are usually painful, they can be treated with topical analgesics or anesthetics to relieve the pain. And if the ulcer is suspected to be caused by an infection, then an antibiotic may be used to treat the infection. Moving on to the esophagus, a common condition affecting the esophagus is GERD, which stands for gastroesophageal reflux disease. In GERD, the acidic contents of the stomach are refluxed back up into the esophagus, causing inflammation of the esophageal mucosa. GERD is caused by an incompetent lower esophageal sphincter. This is also known as LES. So the LES is also known as the cardiac sphincter, and this is a ring of muscle connecting the esophagus to the stomach. So usually it is closed except when allowing food to pass from the esophagus to the stomach. But in a person with GERD, the LES does not close tightly. This allows the acidic stomach contents to enter the esophagus and cause irritation. One condition that can increase the risk of GERD is hiatal hernia. Normally, the esophagus is in the chest and the stomach is in the abdomen. But in hiatal hernia, as you can see in this diagram, a part of the stomach squeezes through an opening in the diaphragm and protrudes into the chest. Other conditions which increase the risk of GERD are obesity and pregnancy, where increased pressure on the stomach can cause reflux. There are also certain triggers for reflux, such as certain foods, alcohol, and smoking. Let's look at the signs and symptoms of GERD. Since the esophagus is located in the chest area, GERD can cause heartburn, and this is a painful burning sensation in the chest. This pain usually occurs after meals, especially when the patient is lying down or bending over. That's because lying down or bending over makes it easier for the stomach contents to flow back up into the esophagus. Food is regurgitated and reaches the throat and mouth. This causes a sour taste in the mouth. When the esophagus is damaged by the acid, it can cause difficulty swallowing. And when the throat is damaged by the acid, it can cause sore throat. Let's review the pathophysiology of GERD. GERD is caused by an incompetent lower esophageal sphincter or LES. When LES pressure is lower than the pressure in the stomach, this causes the reflux of stomach contents into the esophagus. The gastric fluids are very acidic. In the stomach is not affected by the acid because it is protected by a thick mucus layer. But the esophagus does not have this thick mucus layer protecting it, so it is more easily damaged. Besides the acid, the stomach also secretes pepsin, and this is an enzyme that digests protein. This pepsin further contributes to the damage to the esophagus. As mentioned earlier, there are some triggers for reflux, for example, high-fat meals, alcohol, caffeine, and smoking. This can decrease the LES pressure, which then leads to reflux. For now, there are no medications that can correct the root cause of GERD, which is the incompetent LES. So, medications are aimed at decreasing the acid damage to the esophagus. For example, antacids can provide some relief by neutralizing the stomach acid. Acid-reducing medications decrease acid secretion by the stomach, so that even when reflux occurs, it will be less damaging to the esophagus. Besides taking medications, lifestyle modifications are also important in managing GERD. For example, eating small frequent meals instead of a large meal. Weight reduction if the person is obese, since obesity is a risk factor for GERD. Sitting upright for at least 2 hours after eating, and this is so that gravity can help to keep the food down. Sleeping with the head elevated. Again, this makes use of gravity to help prevent reflux. To elevate the head, putting extra pillows under the head is not enough. The whole upper body should be elevated. This can be done either by putting a block under the bed, like in the first picture, or by using a wedge to raise the upper body, as shown in the second picture. Finally, the person should try to avoid triggers of reflux, such as alcohol, certain irritating foods, and smoking. Now we move on to the stomach. Gastritis is a condition where the mucosal lining of the stomach becomes inflamed. There are a number of possible causes of gastritis. The most common cause is a bacteria known as Helicobacter pylori. This is a spiral-shaped bacteria that infects the stomach. Drugs such as aspirin and NSAIDs are another common cause of gastritis. NSAID stands for non-steroidal anti-inflammatory drugs. Both aspirin and NSAIDs are painkillers which work by reducing the production of prostaglandin, which is involved in pain and inflammation. However, prostaglandin is also important in protecting the stomach against acid. I'll explain the role of prostaglandin in more detail later on in the lecture. Some other factors may also contribute to gastritis, such as excessive coffee or alcohol, smoking, or stress. A person suffering from gastritis would have dyspepsia, which is indigestion, and mild pain in the epigastric region, which is the upper central region of the abdomen. And this is especially when the stomach is empty. The treatment of gastritis is mainly to reduce the amount of acid in the stomach and to eradicate H. pylori if it is present. When only the mucosal layer of the stomach is inflamed, it is referred to as gastritis, but if there is a deeper erosion of the stomach lining, it becomes a peptic ulcer. This figure shows the diagram of the different layers of the stomach wall. The first layer is the mucosa. This is the layer that gets inflamed in gastritis. But in peptic ulcers, the mucosa has been eroded, and this erosion continues into the submucosa and even the muscularis mucosa layers. Peptic ulcers can be classified into gastric and duodenal ulcers depending on their location. Duodenal ulcers are more common. Around 80% of peptic ulcers are duodenal ulcers. In this picture, you can see that if an ulcer forms in the stomach, here it is called a gastric ulcer. If the ulcer is in the duodenum, then it is a duodenal ulcer. Most ulcers are caused by H. pylori infection. The next most common cause would be aspirin or NSAIDs. This is a picture of a duodenal ulcer on the left and a gastric ulcer on the right. These pictures were taken through endoscopy, a procedure in which a camera is inserted through a long flexible tube into the stomach and duodenum. Interestingly, peptic ulcers don't usually affect the very young or very old. Most ulcers occur in patients between 25 to 64 years old. They are mostly caused by H. pylori infection or by the use of NSAIDs. Another possible cause of peptic ulcer is hypersecretory disorders where the stomach produces too much acid, but this is not common. Before we look at the pathophysiology of peptic ulcers, let's look at what happens in normal physiology. Normally, the stomach is well protected from its acidic contents. The stomach secretes a thick mucus layer which acts as a barrier between the stomach lining and the acid. The stomach also secretes bicarbonate which helps to neutralize the acid. The stomach tissues produce prostaglandin E, which increases bicarbonate secretion, mucus secretion, and mucosal blood flow. The blood flow in the mucosa helps to remove excess acid from the tissue. So under normal conditions, there is a balance between gastric acid secretion and these protective factors. However, if the balance between gastric acid and mucosal defense is disrupted, mucosal injury can occur. For example, H. pylori increases the aggressive factors by causing inflammation of the gastric mucosa and hypersecretion of gastric acid. It also decreases mucosal defense by reducing mucus secretion. H. pylori is transmitted through the fecal-oral route, so it enters the stomach through the mouth. It usually infects the stomach or duodenum. You can see in this picture that H. pylori have flagella which help them to move and burrow into the stomach lining. H. pylori produces an enzyme known as urease, which breaks down urea to form carbon dioxide and ammonia. Since ammonia is basic, it neutralizes the gastric acid and provides a protective environment for H. pylori to survive. H. pylori continues to multiply, and it causes inflammation and damage to the mucosa. As mentioned earlier, NSAIDs are painkillers that work by reducing prostaglandin levels. But since prostaglandin is important in mucosal defense in the stomach, this can leave the stomach lining more susceptible to injury. Physiological stress can also cause peptic ulcers in patients who are critically ill. For example, someone who is involved in a serious accident or has a serious burn injury. Stress causes the sympathetic nervous system to be activated. When the sympathetic nervous system is activated, more blood will flow to the brain and to the muscles. The GI tract is considered less important, so less blood flows to it, and this can lead to ischemia. Since H. pylori is the main cause of peptic ulcers, a diagnostic test to detect H. pylori is usually done whenever patients have symptoms of gastritis or a peptic ulcer. If someone is going for an endoscopy, then a biopsy of the affected tissue can be taken to check for H. pylori. Biopsy means that a small sample of the tissue will be taken for examination. A non-invasive test is the urea breath test. The procedure is shown in the diagram. First, the patient is asked to drink a solution containing urea that is labeled with a carbon isotope. This carbon could be either carbon-13 or carbon-14. You can see this here. Since H. pylori produces urease, the urea will be broken to produce CO2. And you can see this here. So this CO2 will contain the labeled carbon, which was either carbon-13 or carbon-14. After a certain duration, the patient breathes into a machine which measures the concentration of the labeled carbon. If the concentration is high, it means that urease is present in the stomach. And since the human stomach does not produce urease, this can only mean that H. pylori is present. The fecal antigen test uses monoclonal antibodies to detect H. pylori in the stools. Patients with peptic ulcers usually experience indigestion, abdominal pain, and nausea and vomiting. If the ulcer is bleeding, then blood may be present in the vomit. The blood is brown and coagulated, and it is said to resemble coffee grounds. The blood would also be passed out in the stools, resulting in melena, which is the dark, tarry stools that are associated with upper GI bleeding. Patients with peptic ulcers may also experience weight loss or weight gain depending on the location of the ulcer. Gastric ulcers would cause pain when the stomach is full, because when the stomach is stretched, the ulcer would also be stretched. So people with gastric ulcers tend to eat less and therefore lose weight. On the other hand, duodenal ulcers cause pain when the stomach is empty. The duodenum receives the stomach contents. When the stomach is empty, the gastric fluids are very acidic, Whereas during a meal, food reduces the acidity of the stomach contents. So when the stomach is empty, the duodenal ulcer will be exposed to more acid, causing pain. Therefore, people with duodenal ulcers tend to eat more and gain weight as a result. If left untreated, peptic ulcers can result in serious complications. One complication is bleeding. If the ulcer erodes through the stomach wall, it can cause perforation when the stomach contents leak out into the abdominal cavity. If this happens, it causes sudden and intense abdominal pain. Perforation is a medical emergency requiring immediate surgery. Sometimes the ulcer may erode through the stomach wall into an adjacent organ. This is called penetration. Earlier I mentioned perforation and penetration. If an ulcer develops here, let's say here, and breaks through the stomach wall, then the stomach contents will spill out all over into the abdominal cavity. This is called perforation. But if an ulcer develops here, where the pancreas is right next to the stomach, then if the ulcer breaks through the stomach wall, the stomach contents will not spill out since it is blocked by the pancreas. Instead, the erosion will continue into the pancreas, and you can see that in this square part of the diagram. This is called penetration. Peptic ulcers may also cause obstruction of the GI tract, especially when the ulcer develops near the pyloric sphincter. The ulcer can form scar tissue around it, blocking the pyloric sphincter, or the pain of the ulcer can cause the sphincter to spasm. Over a long period of time, chronic peptic ulcers can eventually lead to cancer. Medications for peptic ulcers mainly focus on reducing the acidity of the stomach contents and protecting the ulcer from further injury. If the ulcer is caused by H. pylori, then a combination of antibiotics will be used in the treatment. Besides taking medication, some lifestyle modifications can also help. Avoid alcohol and caffeine, which can irritate the stomach. If the ulcer was caused by aspirin or NSAID drugs, then these drugs should be discontinued. Smoking can increase stomach acid and reduce mucosal defense, so stop smoking. Since stress can contribute to gastritis and ulcers, stress management techniques can also be helpful. That's all for part 1. Click on the video for part 2 to learn about diarrhea and diagnostic tests for GI diseases.